Late, or had already done their hours. So, you know, being on tab, you know, on mark, on tab, I don't know what I'm trying to say.
The timing is essential, yeah.
Yes, that's what I'm trying to say with the DCF in-service hours and things.
Lori, can you hear me?
Okay. Can you, yes,
Sorry, we have some technical issues on our side. Laura, I'm just turning it back over to you.
Thank you, Jim. So thanks, Jim, for that welcome, and thanks everybody for being here. We have a very large virtual meeting today. As Jim said, the trust has been here for a long time in the community to support children and families. Many of you on this call today have been part of that mission with us, and we're looking forward to continuing to work together to have a community that visions to meet the essential foundations for all children to reach their full potential. So let's talk a little bit about an overview of our agenda today. I'm going to talk a little bit about our goals, and then we're going to break this up into 4 sections of information sharing. We're going to go over the overview of the Family and Neighborhood Support Partnerships Initiative and the populations that it's focused on serving. And then we're going to tell you about the service model that we expect to be implementing in the new funding cycle. We're going to be talking about the staffing and partners aspects of the partnerships, as well as our outcomes and our metrics. We're going to pause at the end of each of those 4 sections to collect your reactions, feedback, input, as well as your clarifying questions. We are going to do that in a way, since we're such a large group, that we can have that collected through a Google Doc, which we're going to share with you shortly. And then we're also going to be having a Google Sheet that has the information from everyone registered today to be able to exchange some networking contact information about what you do and where you do it. And so we go to the next. So as I said, my name is Lori Hansen. I'm the Chief of Research Evaluation and Strategic Planning for the Children's Trust. And today I'm going to be joined in this presentation by Ashley Pugh, our Research and Evaluation Analyst for this initiative, and Devon Ritchie, who's our Associate Director of Programs for this initiative. And we're going to be sharing a lot of information with you and hopefully clarify any questions that you have. So we also, I should say, have a number of trust staff here with us supporting and contributing as resources from our communications and community engagement team, from our programs team, our research team, our operations team. We're all here in support of this initiative. First, we want you to learn more about our investments in this area, including some of the planned adjustments that we're going to make to the service model that we expect in the new funding cycle, which starts next October, so almost a year from now. As we review those elements, we're going to pause for your questions, as I said. We also have a goal of sharing. So that's a challenge in such a large virtual meeting format, but we have some tools that we're going to hopefully collect your thoughts and your input about some of the planned service model the experiences that you've had serving similar populations and how you see this might work in our community. We want to know what you think about what we might have forgotten. Have we left something out? What do you like? What should we emphasize more or less? Are there concerns or possible unintended consequences that we haven't thought about? And then finally, connect. Even though, again, as I said, we have a very large group, we have a couple of resources that we're going to be sharing with you to help you connect to future partners in these efforts. So as you hopefully know from the name, the P in FNSP, it stands for partnerships. And successful community partnerships are an essential aspect of this. no one agency or program can meet all family and children's needs. There have to be connections to others, and so we hope to facilitate some of that for you today. So go to the next slide. One of the resources we have, and we're going to put a link in the chat right now to the networking sharing sheet. This is going to be a Google sheet that you can click on the link. You need to have log in to a Gmail or a Google email account to edit. You'll see your name, hopefully, if you registered before this morning. Your name will be listed there in alphabetical order. You can find your information, and you can add some information. If we were in person today, we would be able to do introductions. We would be able to have you guys meet each other or group up in smaller groups about the areas you're serving or the populations you're serving. But instead, we're going to use this virtual tool. It's going to be available throughout this meeting to the end of the day today. And in addition to your contact info there that you can meet other people through, there's a couple of columns at the end. You can see the populations and geographic areas that people said they serve, but you can also add what you provide as a partner, as well as what you might be looking for as a partner, and any other resources that you might want to share. If you have some information about your agency that you want to share with all the people who are here today to know about what you do and your agency, you can put links and resources in that third column. So the document, as I said, is open to that link while we're going through the presentation. You're going to be able to also have access to this document after we close it out at the end of the day. We'll post the completed document online, and so that you can hopefully make some connections going forward after this meeting. Let's see, the other thing, let me just point out one more thing, Tatsi, if you could put that back up. The thing you'll be able to do once you have access to this document and it's completed is you'll be able to sort by region. So if you're in the north part of the county or the south, you can sort and look for other people who are doing in that similar area or who are serving the same population. If you serve a special population, you can, Ashley, I think we need to do some cleaning on the sheet because some of the columns are not in the right place. Sorry for the ones that we added probably this morning. Okay, so we'll be having this sheet open for you to add information. So let's go back to the PowerPoint. Go on to the next slide. So as I said, we have a large group. We had more than 350 people registered, and I think we have about a couple hundred on the meeting so far. So we're just asking for you to stay present and engaged as much as possible. We're going to change speakers up so you don't get tired of hearing one of us too much. We want you to contribute as you feel comfortable in the document that we're going to share with you. Can we share that link as well? So there's a Google document that has the sections of our presentation, as you can see here. On the left side, there's a column for you to add questions. After we go through the information, if you have a clarifying question, we'll try to answer it. There may be some questions that you pose to us that we will have to answer later. But again, all of this information will come back to you at the end of the day, or at the end of the meeting within the next week or so. And we just ask that you give us your feedback on this document, and that you ask us the questions that are coming up. Let's go to the next slide. So first of all, I already mentioned that FNSP stands for Family and Neighborhood Support Partnerships. So this initiative is one of the most deep-end intervention-focused investments of the Children's Trust. So most of our funding has a very preventive focus that's open to everyone, and things like after-school programs and summer camps. This initiative, we're really aiming to support children, youth, and families who need more intensive supports, maybe due to various stressors or challenges that are negatively impacting them in some way. So you can see that we have a participant-centered model, and you're going to hear that we've always had a strengths-based model in this initiative, but in the coming years, we really want to live that more and walk that walk in a more legitimate manner across all the funded programs that we have. So let's go to the next slide. So why do we fund FNSP? So through the trust strategic planning on this initiative that's included some of the current programs that are funded, as well as through work with our board and their strategic planning. We've developed a theory of change, like why do we want to make this investment? Why do we think this is helpful? So our theory for how to help children and families achieve their greatest outcomes is that this requires them to be able to have positive experiences, strong family relationships, but also to be able to meet their basic needs. And this initiative really aims to address all of those aspects of what we think are necessary for families. Go to the next one. So I mentioned the strengths-based framework, and this is the Center for the Study of Social Policies Family Strengthening Framework, and they include 5 protective factors in their framework. So to ground us in this philosophy, we're really focusing on increasing family strengths, enhancing child and youth development, reducing the likelihood of child abuse and neglect among families with children under 18. And you can see that the areas that are of focus to build upon, from parental resilience and social connections to knowledge of child development and youth development and parenting, social and emotional skills for kids, and then those concrete supports, those basic needs that I mentioned, are really critical as part of this work. So this strength-based framework really is aiming to empower families and youth to co-develop their own success plans to determine what needed services and supports they need to build upon their existing strengths. So as noted, we have, as noted on this slide, and in a resolution that's being considered by our board of directors actually later this afternoon, the FNSP funding is going to be proposed to increase from the current amount, which is $9.5 million, to $13.5 million in the next funding cycle. This is because our board identified this as an initiative that has room for expansion, so that we can serve more populations in need. This expanded funding will include about $500,000 to support the basic needs of participants through a fund that's going to be accessible by all partners, a pooled fund of family stabilization funding. Also, we're going to have $200,000 in supports for youth program inclusion and in-home respite supports. That will be managed by one partnership that's going to be focused on high needs children and youth with disabilities. And, you know, importantly to note, because this is a comprehensive service initiative, we acknowledge that the trust money by itself is not going to be enough to meet all the needs. So there is a required match funding for this initiative. To receive the funding, an applicant needs to bring it at least a 10% match to the table. This can be cash or in-kind contributions. And so that is the basics on the fundings. We are expecting that additional $4 million to allow us to bring on maybe about a 6 additional partnerships. Let's go to the next one. So this is a list of our currently funded FNSP populations that are served. And so I'm not going to read these out loud to you, but I'll let them stay here for a minute so you can scan down the list. You can see that there's a common theme here that many families in these different circumstances may be experiencing, you know, needs for mental health supports or connections to other community services. They may have stressors or trauma in their life. that need supports. And those things, as we mentioned in our sort of theory of change, may impact their basic needs, their abilities to provide for their own basic needs. So these are the current populations served. Some of them are based on where people live and what they're experiencing in their own local neighborhood communities. And then some of them are based on other life experiences. Go to the next one. And so through our board strategic planning, and they have identified several additional populations that have come up as priorities for expansion. And so this includes specifically addressing the needs of families experiencing chronic housing instability or homelessness. It also includes, we have a couple of programs already now that are working to support victims of human trafficking or sexual abuse, and those are some projects that we want to see come into this more comprehensive model of family and neighborhood support partnerships. We also have identified that
the one, which one?
someone's not on mute that needs to be on mute.
Oh, I corrected it. I figured out what
Hello?
I was the one for the.
Please mute Maria Rossiter. Thank you.
And the third population that the board specifically identified is that we focus a lot on children and youth with disabilities, but kind of another special need of, that we have identified is that there are high ability or gifted students who may not really ever reach their full potential because of serious lack of economic resources to tap into different enrichment opportunities. So this is these are 3 new populations. Now, we also expect that there might be other populations that we haven't funded before or thought of before. So there can be other justified high need groups that might be served in this initiative. And so that's the first chunk of our overview and population section. So if we could put the Google Doc link again in the chat, and if people can click into this link and let us know what questions you have so far about any of the basics that we covered. I'm not seeing anything in the document yet, but I see some people typing, so that's great. And anything missing, like are there some other populations that you all are aware of that weren't covered on the list that we have, which is pretty comprehensive, but what else should we be including? Are there any concerns so far? We're going to go into more details about the actual service model in the next section. But anything about the population or the general approach to the funding that I've covered so far? Can it be gender specific programs? Yes. So there may be some questions that we will just pause for like a few minutes right now, and there may be questions that we come back to you on as well.
Lori, how about do partners have to be nonprofit agencies?
So the trust funds agencies that are very, you can't be part of the public school system, including a charter school. You have to be qualified to do business in the state of Florida, but you do not have to be a nonprofit specifically. And are we gonna type the answers
Yeah, I'm
in?
gonna start typing.
Okay.
So let you let them know.
Okay, so we're gonna, for the ones that we're answering, we're gonna start to kind of put the answers in with the questions so that you have this as a resource later. So domestic violence makes those children, parents do not have status, the children do for husband. We have domestic violence in our current populations. Domestic violence is definitely one of the things that we focus on. The age range, I'm seeing a question about the age range. This is from birth to 18. For youth with disabilities, it goes up to 20 to 22. And then for kids who are aging out of or transitioning out of the foster care system, it can go up to, I believe, 23. Those details are written in the laws about the programming that supports children transitioning from those, from the foster care system. So let me just see if there are other. Families without health or dental insurance are probably not a target population on their own, just because of that. That might be a need that's addressed across the population that's served. We do have a separate initiative that supports public benefits enrollment for families who just need access to public benefits. So we would be looking for other types of challenges that families are facing that might meet the wraparound care coordination model that we're going to describe in just a few minutes. Is there any specific emphasis on geographic area of Miami-Dade? So yes, if you're going to propose a geographic-based area, like a neighborhood that's impacted by some specific factors, that would have to be described and justified. Currently, we do have a number of programs that are, and you'll see a slide later, I think, that shows you the neighborhoods that are covered by our current programming. Impacted by gun and gang violence, that would be for sure like one of the factors that might be impacting a specific geographic area. Young people in the child welfare system, yes, that is actually one of our currently funded populations, and we would like to continue. That is definitely a high need population. Can it help fund boarding school? No, we cannot fund school directly. Multiple populations, is it possible to have special populations? We're not talking about points today. There's no RFP out at this moment. We're just giving you information about the initiative. Right now, we're talking generally about the populations in need will be the ones that are the focus of the initiative. Later down the road, you'll get a timeline later in this meeting. You'll know when more specifics might be coming about a detailed funding opportunity. Okay, so can you scroll down, Tatiana? Is there anything else? Okay, I think we're also looking. Any feedback, Yvonne, that's on there yet?
Opioid overdoses, children and families affected.
Okay, that might be a population that's missing, or yeah. So I think definitely. So one of the comments about opioid involved families, that's definitely one. We have talked historically about children who have parents that have their own substance abuse issues. That would definitely fit into that category. So any other? Termination of parental rights. CDS is termination of parental rights. That's CDR. Oh, CDS. We do, yes, we have actually, if you can go back to the slide, Tatiana, that has our current populations on it. Up to maybe. Yeah. So we do currently have partnerships that support youth who are experiencing immigration challenges or in need of legal advocacy. As I also mentioned, we do have current programs that are focused on children who are exposed to family conflict or domestic violence, as well as children involved in or transitioning out of the child welfare system. So you can see here, we have a pretty wide gamut, and I appreciate everybody's input. Ashley, you ready to tag team? Yes. So now I'm going to hand over to Ashley to talk about the new service model.
Good morning, everyone. My name is Ashley Pugh, and I am the Research and Evaluation Analyst at the Trust for the FNSP initiative. So as you can see here, first and foremost, the Children's Trust funds FNSP programs throughout Miami-Dade County specifically. And here you can see on the map that Lori was referring to the 23 high-need neighborhoods located throughout Miami-Dade County that have been a priority for the Children's Trust. When we are looking for partnerships and where they're going to be delivering their services, it's important to note that services need to be accessible in convenient locations and familiar places to the high-need families and youth that will be participating. This includes home-based services as well as contacts at places like schools, childcare facilities, community centers, primary health settings, faith-based settings, parks and libraries. Convenient and flexible operating hours, including afternoon, evening, and weekend hours, are an absolute must, as these are critical for reaching the high need populations and making sure that the services are convenient for them to access. All aspects of services in our new funding cycle will be tracked in a centralized care coordination and community referral tracking module that is being built within our current Trust Central reporting system. And we will talk a little bit more about that when we talk about the activity of care coordination. So here we have our model, which goes from the time the referral is received through eligibility screening, assessment, care coordination, and optional direct services. And we're going to go into each one of these items. So referral received, based on partnership relationships in the community, they will know exactly how to effectively reach out to find families and youth from their intended service populations. This will include connections with key community referral partners, and we're expecting responsive contacts with families and youth.
Want to come see the musical?
Sorry, can everybody mute? So after a family or youth is referred, they will go on to the eligibility screening. We have a common eligibility screening where we'll also be asking the partnerships to add specific items that are related to the populations that they're serving. What the eligibility screening includes, we first have a section on demographics, and then we have questions such as, has the child gotten in trouble for fighting in school? Has the child been exposed to violence? Is the family experiencing housing instability? Are there any mental health symptoms of the youth or the family that need to be addressed, and so on. If any of those questions that I just, there's many more obviously, if any of those are answered yes, the family or youth is eligible for care coordination. If not, it's possible that the family or youth just needs a one-time support, which we're referring to as information and referral services only. We will be asking partnerships to document that, and we are allowing that. However, that should be the smaller population that is served. We're looking for those deeper end services. So after they go through the eligibility screening, those who are eligible will go on to the assessment. In the new funding cycle, we're using two common tools across all partnerships, and all service staff and supervisors will be trained, and they will be trained by the trust. So the first one is the PAPF, the Parental Assessment of Protective Factors, which measures parental resilience, social connections, concrete supports and sense of need, knowledge of parenting and child development, and the social and emotional competence of children. The next is the CAMS, the Child and Adolescent Needs and Strengths Assessment. This is a functional assessment to support decision-making, support with care planning, quality improvement, and monitoring of outcomes and services. The reason why we've added the CAMS was for numerous reasons. One is that we're looking to have a, what you can see in the bottom here, service levels based on needs. So we wanted to make sure that when partnerships are serving youth and families, that it's really tailored to the needs of those families. We know that some families and youth will need shorter amount of time in service, and they'll need less intensity of supports, and some are going to require a lot of intensity, and those needs are going to fluctuate as they go throughout the program. So the CANS was the one assessment that we identified that was meant for leveling. So based on the item scoring, families and youth who received higher scoring will be enrolled in what we call level 2 care coordination. We're expecting higher intensity, higher frequency supports from the partnership. Those families and youth who have lower scores will be enrolled in level 1 care coordination. We're expecting that those families or youth might not need as much support. They don't need as much hand holding. They might be able to go to appointments on their own. And they can also, the leveling is dynamic, so they can go from level 1, if something destabilizing happens, they can move up to a level 2. And that way supervisors can support their success coaches and make sure that they have appropriate caseloads and enough time to really tailor to the family or youth. And then just to recognize, as Lori had talked about, the fact that we are focusing on strengths-based framework, the CANS is directly tied to identifying strengths, which will help our success coaches identify strengths that can be used to support family and youth goals. And so care coordination is our primary activity. It places the family and youth in the driver's seat and is grounded on strong relationship building with participants. This is the primary activity and includes the ongoing identification of needs, which are addressed through individualized success plan goals, facilitation of access to services through direct and community referral linkages, and coordination of services to adjust level of supports and problem-solve service barriers. In the activity, we're expecting that success coaches are utilizing motivational interviewing, that they're listening to the family and youth, that they're updating goal status, referral status, addressing barriers to accessing services. We're also expecting that once a month, an in-person care coordination session takes place. That way they can meet face-to-face, which might allow for greater discussion and also conduct welfare checks. In the new funding cycle, in the new module that we will be building out, we are expecting documentation of all contacts with family and youth. This is so that we can truly understand and partnerships can reflect the time that is spent, whether it's advocating on behalf of the family and youth in a school setting, going to appointments, doing a goal status check-in. So we will be asking that all of this is documented and the reason for meeting is also documented. And then, I'm sorry, it's also during the goal progress check-in, any adjustments to leveling will be made. Many times the partnerships population focus may indicate the need to offer some specific direct services frequently needed by the population served. These should not include services that are readily available through other existing trust-funded contracts or community services. The groupings of the services that may be offered are shown here. And definitions will also be provided. So now we're going to take a break. We're going to go back to that Google Doc that we were just on. Scroll down to the service model section and please enter your questions and share your feedback with us. Give you a few minutes. So we're looking for questions on the FNSP core service activities that we described: referrals, eligibility screening, assessment, care coordination, and other additional direct services. And then we're looking for your feedback or concerns about what you think of our service model. What challenges can you think of to offering quality services that might meet the needs of the intended populations do you see? Or feel free to provide other input. I see there's a question here about hybrid service delivery. We will be allowing virtual and in-person services. The shorter interactions for care coordination. So basically, we're asking you to tell us how long you're spending with families, and we're not setting a requirement that it's 45 minutes in person. We're saying if you spend 30 minutes on the phone with the family, let us know. If you spend an hour and a half in person or at an appointment, document that time. We'll be asking you to add it in 15-minute increments. And then I see somebody's asking about family stabilization funds. we will actually be changing the way we've currently been doing that. We will have a pooled amount that all providers can draw down from.
Takes time.
Oh, in terms of is this going to require trained mental health professionals to conduct the assessments? No, the CANS assessment requires a bachelor's degree, and then the trust will be training everyone who needs to be trained.
That's just the question about the optional direct services.
Oh, right, projection. Oh, yeah, it's just hard to see.
Yeah.
Scroll down.
Is this going to require?
Can we connect with other services offered in-house? So the question is about the optional direct services, do they have to be out external?
Yes, so you can repeat the question. Yeah, okay, so the question on the clarification needed on optional direct service restrictions. The partnerships can be in-house or external.
But partnerships.
Yeah.
And then I see. Can we complete the assessments over time, as it takes time to build trust with families and children, and these are detailed assessment tools? That's a great question. So we understand that sometimes it takes time for the relationship to be built for families and needs to open up. And that's the reason why we have specified that there needs to be a monthly goal check-in. So we will still expect that at intake, those assessments are completed. However, when the success coach comes across something that needs to be addressed, or the family or youth decides to reveal additional details or needs, they will then be added to the success plan. And that can be done on an ongoing basis. It doesn't need to wait until the monthly check-in. But we will be asking that those are the goals are constantly updated. So you can add goals, you can pause goals, you can say that this goal has already been completed. In light of the challenges created by the pandemic, why aren't mental health services more strongly emphasized? It seems that care coordination is the focus, yet there has been a documented marked increase in mental health issues for youth. So care coordination is a primary activity for family and infant support partnerships, but we obviously encourage, if that is a need of the population you are serving, that you have a partner to address those needs. And that would be detailed in the application.
Or you could address them directly.
Or you can address them directly, exactly. That would be then your optional direct service. You would be proposing. Any additional questions?
Does provision of services for underserved children with coordination of other partners after screening and assessment of need fit within the model?
I see a question on homelessness. Can we use the homelessness management information system to make referrals? Yes, we will be asking if you currently use a referral or a documentation system, and we will be also following up to see if you'd like that to be connected to our care coordination and referral system.
Maybe comments on when we fund other services directly, we're not funding them for years. So somebody's asking about oral health services, and we have oral health funded separately in the different initiatives. So
Yes, so there's a question regarding oral health. So we actually have an oral health initiative that we would be funding through that initiative.
and that that's a kind of a rule, a guideline for all the direct services.
Yes, and so for any of the direct services, if we currently fund that, we would be funding that through those initiatives, not through this one.
Is there a system for? Is there a system for following up on referrals or tracking what's being done by the referral partner?
Yes, the question in regards to the referral tracking, our new system will allow for that. It will allow for those that you refer out to, that they can actually update whether, let's say the youth is engaged in services, if there's a wait list, and that information will automatically be sent back to you in the system. Is there any input?
How often will the level of care coordination be updated? If someone changes from level 1 to 2, how do we document that? It's
Okay.
not,
The question, the input about the level of care coordination, the level can be updated at any time. If the family or youth has something destabilizing and they really need additional supports, they can be moved to a level 2 at any time, and then obviously move back down to a level 1. That will be documented within the care coordination and referral system. You would just identify the date and the reason for the change in level.
and someone notes that they think that individuals who always spend down their family stabilization funds should also have specific amounts in addition to the pooled amount in their contract.
And we will have to discuss that internally and get back on the family stabilization. Are there additional questions?
Did you already answer, are we required to keep cases open for at least 6 months?
Oh, no. In reference to the question about keeping cases for 6 months, there is no minimum. So families can be in the program for 3 months, they can be in the program for 2 years. We do not have any requirements around that.
Yeah, there's a specific question, last question. There will be required to complete all 3 assessments for each participant family. 3 parent assessment of protective factors for LGBTQ youth. Guardians may not be willing to engage, though we've seen an increase over the past 18 months.
Thank you for the question in regards to conducting all 3 assessments for each participant / family. For those where guardians may not be involved or willing to engage, we would then just expect that the CANS is conducted. And we would be discussing that with each partnership based on the population that they serve. I think for time purposes, we should move on to the next section. However, please keep adding your questions and input and we will get back to you. I'm going to now hand it over to Yvonne to talk about staffing of partners, but as a reminder, the link for the networking sharing sheet is in the chat. Please feel free to continue to add to that. Let everyone here know what kind of services you offer. If you're looking for partners, please use this sheet as a way to network with everyone.
Good morning. So I'm going to talk to you about staffing. I'll introduce myself again, Yvonne Ritchie, one of the APs of the Children's Trust. This is a new initiative for me. So happy to be here today and see so many of you on board with us today to discuss this exciting venture and the opportunity to get your input. So I'm going to first start by talking about racial equity, diversity, and inclusion principles that we're following. So the trust, and you'll see us refer to as READY. It's just a simple way of bringing that together. The trust READY work in our programs and the community require attention to various aspects of diversity and their influence, such as those listed here, right? So we really need to acknowledge that the diverse strengths and the needs of children, youth, and their families in our community, taking into consideration such characteristics as language, ethnicity, race, sexual orientation, gender identity, expression, spirituality, beliefs, exceptionalities, and unique abilities, and socioeconomic status, and immigrant status. practical cultural humility, we need to practice cultural humility and mitigate implicit biases in the service provision. Historically, structural inequities have resulted in implicit biases that can negatively influence decision-making, interpersonal interactions, and policies. Staff and partners must ensure that implicit biases are mitigated in their partnerships through appropriate staff selection, training, and supervision. FNSP staff must understand and be responsive to complexities and needs of the population served. This knowledge and expertise enables them to provide culturally competent, appropriate, clear, accurate information. Staff should be conversant in the languages spoken by participants and reflect the families and the youth being served. So what is our staffing expectation? Okay. Partnerships are staffed by a team of management, clinical and direct service professionals, and paraprofessionals. They are solution-focused, strength-based team approach to care coordination. All staff are expected to be able to develop strong, positive, and trusted relationships with parents, caregivers, children, youth, teachers, school administrators, community health workers, and other community partners. To convey the importance of strength-based foundations of the FNSP services, staff who provide care coordination will be referred to as success coaches in the new funding cycle. Oftentimes, individuals were called out as care coordinators. We're moving to using the term, which is a strength-based term, as success coaches. Natural helpers and community health workers are required to be included in all paid positions in the care coordination team that support family and youth engagement in needed services that support their goal achievement. Natural helpers are paraprofessionals who typically reflect community and the population served by the partners and may even be previous program participants. This less formal social support relationship natural helpers offer families and youth are practically effective for engaging in behavioral health, substance abuse, and parenting related services. Therapeutic services must be provided by master's level clinicians with appropriate training or certification in the interventions offered. Often these professionals being engaged bring engagement tools such as motivational interviewing techniques to the team that can increase family and youth engagement. Staff professional development and training are key to FNSP, and the Trust provides many resources in this regard, including online courses, life training, peer learning activities and coaching. Management staff who supervise direct service staff.
I need you all to focus. Stop yelling out my door.
Please mute yourself, thank you. Okay. Management staff who supervise direct service staff are expected to be trained in the same content taken by their staff. In addition, weekly staff supervision should be provided in group and individual formats with a strength-based focus on reviewing the specific needs of families and youth being served, and challenges the staff has encountered, as opposed to more administrative review items. So staffing service are, and I think earlier Ashley mentioned, both Ashley and Lori mentioned that we were looking at things differently as it relates to the population served. And what we're doing is we're doing something a little bit different as well as it relates to the staffing and how we're tracking staff time. So all direct service staff are expected to spend at least 75% of working hours delivering service activities with families or youth to be documented through participant context entered in the care coordination reporting system. FNSP, this is very important, FNSP services in the new funding cycle would not be contracted based on the number of participants to be served. Because each family and youth may need different frequencies, intensities, and duration of support, FNSP will contract based upon the expected number of direct service contact hours to be delivered based on the number of staff funded in the staffing plan. All direct service staff are expected to spend at least 75% of working hours delivering these activities with families and youth. And as noted, it will be documented in the system. So I'm going to give you an example of what that might look like. So for example, a full-time direct service staff member who works about 22,080 hours annually with 2 weeks of annual leave will be expected to document 1,500 hours of direct participant contacts in the system. These services may include meeting directly with families and youth, going with them to appointments, making and following up on referrals, warm handoff with community partners, advocating on behalf of families and youth, and any activity that supports peer coordination and participant success plans. The remaining time is allocated to non-direct service activities such as staff training, supervision, documentation, and travel activities. FNSP contract deliverables will be units of services tied to the staffing plan. Okay, so partners work together to strengthen the system of care. So it's important to note that FNSPs, and Lori mentioned that these are partnerships, right? Cannot be effectively implemented by a single organization. Rather, multiple formal and informal community partners must operate within a collaborative structure to actively coordinate an array of broad, flexible services to meet the needs of the participants. Partners refer families and youth to the FNSP, and they may also offer community services to which participants are referred in pursuit of their success plan goals. Partners may be paid for needed services, or they may offer the services in kind through other funding sources. Whenever possible, participants are encouraged to leverage other funding sources to offer participants access to needed high-quality services. Coordination of services is facilitated by cross-agency data sharing regarding shared participants with proper consent. Participants are formalized through executed memorandums of understanding among participating organizations. Strong communication among partners is key to the seamless service coordination, from the initial parent contact and referral to shared assessment results, treatment engagement, and follow-through care. Information about referrals in and out from the FNSP will be tracked in the care coordination and community referral reporting system to ensure the participants receive needed supports, that participants are capitalizing on the trust network of funded services. And other FNSPs should strive to ensure their networks are current, high quality, and responsive to participant needs. This may include a range of partners relevant to the population to be served, such as those shown here, right? So that could be community-based organization, child welfare partners, law enforcement, faith-based organization, and specific organization to your population. Okay, so now that I've given you an overview of the staffing and the partnership approach, please utilize the sheet to ask the questions and provide the input.
One of the questions asked, if you could just repeat the thing about the staffing time expected to be spent directly with participants.
Yeah, so 75% of your time, and that could be depending on how you're working. We gave the example of overall annual time, But depending on the level of when your staff are working, if you have full-time, part-time staff, 75% of that time is expected to be working in direct services, and the other 25% is when you have a sort of the flex time to do the other parts of the more administrative parts of the job. And the direct service is pretty broad. It's about the care coordination and referral aspects of the program that relates to the success plan.
Question, can we partner as a location, for partners to provide services as a location?
Yeah, I would say yes. We've had in the past organizations that provide space for services to occur.
What are examples of educational entities?
Schools, childcare.
Yeah, I would say, yeah, we did have childcare listed, but schools, charter schools, were prohibited from directly funding the school system, but schools, organizations, tutoring providers. Let's see what else is educational. Thinking about a parenting educational provider or an adult education provider as well.
I want to go back to the third question is about speech therapy, occupational therapy, and I'm going to give you that type of answer. This could be possible depending on the demonstrated need of the population.
Okay, so regarding the question about is therapy, speech, occupation or physical therapy accepted in the project, disability services? Yes, but early discovery is a short-term program for the risk children, for at-risk children. We wish to serve those who are diagnosed and need more than this.
So if they're diagnosed, they should be served through early steps or fiddlers.
Correct. Yeah. Oh, yeah. So, yeah. So so we do have both an early intervention system in our community and an intervention system through both early steps and fiddlers, and also through Miami County Public Schools. So there is a mechanism to provide services to this population. So supports would be things that are excluded from those systems.
And they're saying those sometimes services are quite limited, and I think that would be the case that you would build for that population.
Yeah. So agree that oftentimes within those systems, there are limitations. So as such, in an application, someone could make the case that due to those limitations, there is an additional need. Okay, yeah, so as we continue to answer the questions, we also have the opportunity for you to share your input and your feedback. So if you can share your feedback or concerns about what else we should consider regarding FNSP staffing and community partnerships.
If you scroll to the next page, Tatiana, there's a question about what system is being used. So just to clarify, we're developing the system.
Yeah, so there's a question about the system for tracking data. We are in the process of developing a system, so it will be a new system and it will be ready by the time that we move to contracting.
So do you want to go on to, I don't see anything in the feedback section, so do you want to switch on to the metrics?
Yes, so thank you. I'm going to turn it over back to Ashley.
So now we're going to move on and discuss metrics and outcomes. So we first want to talk about continuous learning and quality improvement. The Children's Trust is a learning organization, and likewise, it expects all funded providers will practice ongoing reflection on program operation and quality improvement, with the ultimate goal of increasing impact for the children and families served through offering higher quality services. Key performance metrics are derived from observations of program activities, participant satisfaction feedback, as well as reviewing contract and participant data. Staffing includes items related to having qualified staff in place with proper training and supervision. Service delivery relates to timely responses to referrals, alignment of assessment results with levels of service and actual contact hours, as well as program fidelity observations and participant satisfaction. Data quality is reflected in the accuracy and timeliness of required information entered in the care coordination and community referral system based on records review. Population focus reviews whether the intended population is successfully recruited and that children and youth with disabilities are appropriately included. Program participation will look at whether the hours of service delivered are aligned with the funded staffing plan, the one was just discussing, as well as consider participant engagement and retention levels, the number of screenings and assessments conducted, the numbers of participants in care coordination, and the number of success plan goals in progress are also part of program participation. Participant outcomes reflect the number and percentage of participants who make progress towards and achieve their goals, as evidenced through reduced needs ratings, increased strengths ratings on the hands, and success plan goal achievement as detailed further in the following slide. All programs, no matter how high functioning, can find ways to improve through reflecting, analyzing, and learning about how their program is working. Growth planning is a collaborative approach to regularly review and reflect upon program information with management and direct service staff, paid and unpaid partners, as well as participants and other stakeholders. Providers regularly review and update their growth plan with their Children's Trust program manager. Provider program supports are available to support program growth. All FNSP providers are required to engage in the available supports, which include online courses, live trainings, peer learning activities, and coaching. Success coaches and natural helpers participate in monthly communities of practice with staff in similar roles across funded partnerships, with the goals of learning and sharing about effective practices in care coordination. Other required trust trainings are focused on ensuring consistent implementation of the FNSP initiative. Examples of topics include the Family Strengthening Framework, Cultural Humility, Common Eligibility Screening and Assessment Tools, Success Planning Practices that engage families and youth, and use of the required care coordination and community referral tracking system. Here on the screen, you can see our participant outcomes, which uses the CANS assessment. So in this funding cycle, we wanted to make sure that the CANS, which helps with the success planning, is also then used to monitor outcomes, as well as the success plan itself and an FNSP participant satisfaction survey. Because each family or youth served may be pursuing different goals in their success plans, our participant outcomes are focused on whether they are making progress toward and achieving those goals. We're also interested in whether services build up participant strengths, as well as how satisfied people are with services received. You will note the standard measurement tools and timing to be used in the outcomes across the initiative. And when additional direct services are provided by a partnership, they will have additional outcomes specific to the expected impact of those activities. Now we're going to pause and ask what questions you have about the metrics and outcomes, and share your feedback or concerns about what additional metrics and outcomes we should consider. And the link was just put in the chat again in case anybody needs access.
plan. Required by. Will we be responsible for our own coaching plan or one that is required by the trust?
So I see a question related to the coaching plan. I'm not exactly clear on the question. If you could just add a little bit to that to help me understand.
The success plan, I think they're asking about the success plan. Format, right? Are we gonna have standard format for that? Or
Is the question related to whether we're gonna have a format for this success plan for the participants
or a coaching
or
plan?
or a
for
coaching
staff?
plan for staff?
Staff.
Okay, for staff, the program manager and the professional development provider, our Trust Academy partners, will be working with each partnership to identify areas for improvement. So those plans will be developed in collaboration at that time.
On top of the across the board training.
In addition to required trainings across the initiative.
Regarding timelines and goals, what if you receive many referrals at once due to the nature of the population and it is not reasonably possible to connect to all referrals within 48 hours?
So there's a question regarding the timeliness and goals. What if you receive many referrals at once due to the nature of the population and it is not reasonably possible to connect to all referrals within 48 hours? So our response to that is that it's important to connect to these families so they don't feel that they're being ignored, that there's another barrier to service. We would ask that when you submit your staffing plan and the application that you think about, what is a reasonable staffing plan to address the potential volume of referrals. And there's a question about what types of outcomes are you expecting? Tatiana, you go back to the slide on outcomes really quickly. So these are the outcomes that we're expecting: goal progress, goal resolution. These are both based on the CANS assessment, and the goal resolution on the success plan goal status. Strengths building, which is based on the CANS assessment, and a satisfaction survey.
Is it possible to offer the training more frequently? Many of us have multiple projects and multiple funders on the days conflict.
Yeah, let's just take that as a feedback.
The comment about whether it's possible to offer the training more frequently, we will be taking that as feedback. Thank you for offering that. So the question, the input we're receiving, we're using some assessment tools for our specialized population established by federal funders such as DOJ. How would we propose these? These can, if they are related to any additional direct services you are providing, you can propose that. And if there's also additional assessments that you feel really reflects the impact of the services that you provide for your specific populations, you can propose that as well. I see a question: how do we document a waiting list? What if we are at capacity and unable to accept new students? Do we need to document our waiting list, or that we have notified someone of being on the waiting list? So we would not expect that there would be a waiting list for an FNSP partner. I'm not sure if that's related to whether you're receiving a referral from an FNSP. If you are receiving a referral from an FNSP, the FNSP would then document that there's a waiting list. That way they would know to try to identify another organization that can provide services. Yes, there will be a template for the individualized success plans.
think they might be asking about whether they reach capacity to, like, they only have 3 care coordinators and they get referrals, and what do they do? And I think we might have to get that.
Okay, right. And just to go back to the question about whether the FNSP is at capacity, we will discuss that internally and get back to you. We will be, just as a reminder, we will be responding to all of the questions and comments in this document and sharing that back out at the end of the day. I see a question about, is the trust going to do a training a trainer for the candidates assessment due to possible staff turnover? I think we will be deciding that shortly, so we will also get back to you on that question. I think that we've addressed all of the questions and input. Again, please feel free to continue adding them here. And now I'm going to pass it on to Ron.
I want to I just want to note that we also noticed that some people are putting questions in the chat. So we will be bringing those over to the document. If you haven't, I see some people make the switch and you move them from the chat into the document, and we have answered them. I just want to also clarify, today's meeting is an informational meeting. And it's a chance for us to share with you what we've been thinking based on our board priorities, based on discussions within the initiative that we have funded currently, and just to get broader community input, and also a chance for you all to meet each other. There is no funding out right now. There is no RFP, ITN, RFQ, whatever you want to call the alphabet. There's nothing out right now. The board actually has to approve the release of this funding, which they will hopefully do tonight at the board meeting. And once that release is approved, you're going to see a timeline in just a minute with Yvonne about what we think the timeline is going to be. But what we want you to do is start meeting with each other now. Start talking to each other now. This networking sheet, Tati, I don't know if you can show the networking sheet. Or if you're putting information here, you guys can also private chat with people. If you see people on here that and you want to go, hey, what's going on? Or if you see people that you don't know and you want to meet them, imagine that if you were in a room with everybody here, that you could go up to people, you can talk to them. Can you scroll to the right-hand column, Tati, all the way over to the columns you were adding? So you can see not a lot of scroll up and down a little bit. A few people have added what they do, what they offer, but a lot of you have not. Of course, if you don't want to partner with anybody, I would not put anything here. But if you want to meet people and reach out and connect, put your information here. This is your place to advertise what you do or what you're looking for. It's kind of it's a rough kind of matchmaker approach. And now is the time to actually start building relationships with people, go to lunch, meet them, see what they do. Don't wait until a solicitation does come out and then there's a time crunch and deadlines and all kinds of other things. So I just wanted to make that comment because a couple people asked about, who's eligible and is it an RFP? Are we funding only established partnerships? No, whenever we do have a competitive solicitation come out, it's always open to anyone to apply. As I mentioned, we do expect to fund about a half a dozen additional new partnerships assuming that the board approves this additional funding. So we will also take a look at the chat when we finish this meeting and make sure that if there were questions posed there that we didn't answer, we'll put them in the Google Doc so that people will have those after the meeting. So
someone put that, it says the Google Doc, there's too many people in it at the moment and they can't access it. Please, I'm asking to leave it open and entering.
if you're having trouble accessing the Google document, just continue to try. We'll keep the documents open after this meeting closes until the end of the day today. Let's say 5 o'clock today. So it should be less crowded in the document. If you're getting a message that's saying you can't get in, we hadn't seen that capacity issue before, but just keep trying and you should be able to get in. Okay, so on.
Okay, yeah, so Lori shared a lot of the purpose of the networking sheet. And you know, if we had the opportunity to host you and bring you all together, it would look very different, and you would have the opportunity to meet in person. But this is our virtual way of making those types of connections, right? So please utilize the network sharing sheet. It will remain open. We know you wanted to pay attention to what we were saying. So as such, you might not have had time, and now many of you are trying to go to the document, but keep trying so that you are able to make these connections afterwards, and so that we sort of fulfill our goal of this meeting is to, in a virtual space, share information and make connections in anticipation of where we're going with our FNSP. So what's next, right? So once you put the information in the document, reach out to any of those potential new partners. Have the opportunity to make those connections. Look at the partners that serve the same population and who offer complementary services to what you're thinking of doing and what you want to provide services to. Build these relationships, actively discuss how you might collaborate before funding application comes forth by the Children's Trust. And regardless of what you want to do, it's about meeting community needs. Be sure you are signed up for the Children's Trust weekly provided bulletin and other announcements, and be careful not to unsubscribe us because you'll get a lot of information through that resource, and be aware of our other funding opportunities, such as our innovation funding and Trust Academy supports that are also to come out. Look out for our solicitation. As Lori mentioned, we do not have a current solicitation out. We have a plan ahead of us, and Lori noted that we're going to the board to let them to get authority to release a solicitation, but we do not have a solicitation out. But we are expecting a release if our plan goes, and we're big on staying on task in early February of 2022. And the new funding cycle will begin October of 2022, which is next year. Okay, so I think we do have the opportunity, since many of you have the direct message. Look at the list. We're going to stay on for a little bit since we have some extra time, and what we can do is we can direct some of those individuals that you see on the sheet that have similar populations of service and start the conversation today. Any other questions, immediate questions before PowerPoint presentation? Yes, you will have access to the PowerPoint presentation.
It seems like there is a problem with that doc, and it is showing emails in the wrong, across the wrong line.
Yeah, we noticed that. We're gonna fix it. We're getting individuals every hour. We're getting a few. I think we're at 350. Over 350. So we're going to make sure that that's correct.
Okay, so it'll correct the line that it's supposed to be on? Because we'll reach out to somebody and it'll be the wrong person that we wanted to partner with.
Just to clarify, we added people to the list and we have extra columns for some people. It should not affect the rows. So the information is still correct. We just need to resort and remove the extra columns that didn't need to be on the sheet.
It did affect the rows.
Okay, that might only if somebody. Okay, well, if you make sure that your information is correct on your row, we will go back and double check the contact info that we have from the Zoom registration. And we'll make sure that data is correct in the rows and the columns. But you need to make sure that what you offer and what you're interested in your populations and neighborhoods are correct with your name. So find your name in the row, make sure your information is correct. And then we will make sure that it matches what people put in the Zoom registration. Scroll to the right. So just as an idea of some of the things people are putting here, you can see there's no need to repeat if you're serving, you know, if the population is already in that column, but you can put more specific information about what you might like to do in these columns about what you're looking for and what you can offer. Scroll down and let's see what somebody says they can offer. Going down. Those are columns that got shifted over, so keep going down. So I'm not seeing too many entries for what people can offer right now. It looks like those are the shifted columns.
Yeah, this one, it's fine. I just want the text is opening about the text.
Look, some of these are, well, we'll clean up this spreadsheet and make sure before we share it. It'll be within about a week from today. All of the PowerPoint, the Google Doc with the questions and the feedback, and the Google Sheet with the contact information from the people today will all be shared on the grants opportunities page. Tati, can you open the grants page just to show people that on the Trust website? So under the grants tab, there's a grants opportunities. You see that drop down on that? So right now there's a little arrow that says Family and Neighborhood Support Partnerships. If you click on it, it will open that to a little blurb that has today's meeting advertised, and it has the general timeline that we're looking at. So this is a very short overview of some sort of what we covered today. This is where we will post the documents that will be available after the meeting. Okay, this is where you find them.
Yeah, and just in general, there were some questions about eligibility. In the same section, there is opportunity for general information.
Yeah, if you go back up to the grants tab, Tati, and go to legal requirement, there's a whole bunch of, there's programmatic funding, eligible applicants. Actually go to eligible applicants. So there's a lot of basic information here about all trust funding that you can find. So we want to thank everybody for tuning in today. We very much apologize. We wish this could have been more meet and greet in person, but when we started planning it a month ago, we weren't sure where things were going. It seems like things are going in a good direction right now. So we look forward to an opportunity to see you all in person sometime in the near future. But we really appreciate your interaction today. The documents will stay open We'll make those available to you on the website and to anyone who couldn't join today. We also recorded the session. So the session recording will also be posted in that same place on the website, the link to the recording. So anything else? Ashley, anything else? All right, thank you all very much for your time today, and we look forward to talking with you all again soon.